name is Kelly Allen. I am an employee here at Ride Out. I work in the ICU, but I'm also working on my master's in nursing education. So what I'm doing here today is I'm going to give you a class on, well, just a little bit of review on infection control. And this is actually to meet a requirement for one of your skill stations. So at the end, there's actually going to be, we have some objectives, we'll review those, and you'll have a return demonstration that you're going to do. So the things that we're going to cover in the class, like I said, I'll go over the objectives. We're going to review the modes of transmission and the different pathogens that are common, in the inpatient environment. We're going to review how do you clean up a blood spill according to, Fremont, our policies, our current policies and procedures. And then also how to remove linen, dirty linen, and trash from an isolation room using the one-person and the two-person method. Okay, objectives. Plain and simple, new employee, each one of you, will return demonstrate cleaning up a blood spill per Fremont Ride Out Health Group policy. You will also return demonstrate removing dirty linen or trash from an isolation room using a one-person and two-person technique. Any questions on the objectives? Okay. And we have a little checklist. After you put the name and date on there, turn that back in, and then Brenda and I will sign you guys off. You'll return demonstrate and we'll sign you off. Okay, so modes of transmission. There's really two types. There's contact and non-contact. Okay, with contact you have direct, indirect, and then droplet. Direct, you think about body surface to body surface. So you have that patient that has a wound, has a dressing on it, and there's MRSA inside that wound. Okay, so obviously you don't want to touch that wound and then become contaminated. And we also think about, them not contaminating us. When you're talking about wounds and stuff like that, inpatient care, you always want to wear the gloves because you want to protect them. Because you have no idea, with all the things that we do, washing our hands and gloving and everything else, there's still that transmission of pathogens. So it's a two-way street. Some of the common things with direct body surface to body surface is MRSA, flu, and then mono. Obviously, gloves is going to be the main PPE that you're going to wear to protect yourself from direct contact, and then also hand hygiene. Now with hand hygiene, the two most common things we use are alcohol. We foam in, foam out, or foam before you put gloves on, foam when you take them off. And then with C. diff, what are you going to do?
Wash your hands.
Soap and water, yeah. All right, indirect. Indirect is infected person to a surface or an object. For example, the bed rail, the bedside table, a piece of equipment, okay? And then the uninfected person, the nurse, visitor, whoever comes in, and then they touch that surface or that object. So that would be indirect. So, there's a lot of common pathogens that can be spread this way as well, but a couple of examples would be the flu, RSV. In this case, you're going to wear gloves and gowns, because if you think about it, when you go in, you're turning that patient, you're pulling them up in bed, whatever you're assisting them with, you're touching that, bedside table or the bed rail or possibly the patient themselves. So you want to have your clothing covered up, okay? That way you can take that gown off, dispose of it properly, and you're not spreading it out into the unit, the floor, or to your next patient's room. Some of the other precautions we also take with indirect is sterilizing instruments and then disinfecting surfaces. And a little bit later, a couple of slides later, we'll cover all the different disinfecting solutions that we have and the kill time on those. Okay, so the last contact is droplet, and we're talking about coughing and sneezing. And remember, with droplet, you want to remember that 3-foot diameter, that little perimeter, because when we cough and sneeze, it doesn't just come out and drop, it kind of flies out there a little bit. So just keep that in mind. Obviously, we're doing patient care, we're going to, get a little bit closer than 3 feet. But when you can, stay outside of that 3-foot range. Some of the things that are common with droplet is meningitis, influenza, and then a variety of your respiratory viruses. So PPE, you're going to wear a mask, you're going to wear a gown, you're going to wear gloves. And if you feel like you need to, you can wear the mask with the goggles on it. And then also, like I said, you want to keep your distance when possible. So any questions on the contact? Nope. Okay. See, it's always a hard crowd, late afternoon. Okay, so we're going to talk about non-contact. And with non-contact, it's really the airborne that we're concerned about in the inpatient environment, but we'll also talk about the other two because it's really good as a review, but then also for patient teaching. So airborne is real tiny particles, and they attach themselves to the air, and they can transport through like ventilation systems. So what's the main one that we think about? TB. TB, and what do we do with the TB patient who's positive? We put them in, yeah, it's reverse isolation, reverse airflow. Yep, so there's specific rooms that have the reverse airflow, and that way the air is not going out into the environment, it's actually going into a system that's getting filtered. Okay. Other ones also measles, chickenpox, smallpox, but TB obviously is the most common. So obviously, now here at Ride Out and most hospitals, you're going to wear the gown, the gloves, and the mask, but really the only thing you're required to wear is the mask. But according to our policy, you do wear everything. So remember that, because I don't know what you do, especially the travelers or if you've worked at other hospitals. I don't know if they've already altered their policies or not, but you wear everything, gown, gloves, and the mask. Okay. So vehicle is the second non-contact, and this you're thinking about a single, contamination, a source of contamination. Think about like a restaurant and, like foodborne type illnesses. And then also like a meat production facility is another common one. For us, if you want to take it into the inpatient, I would hope not, but you think about our little bins that we take from room to room to room, and we put our trash in it, and you guys will have the opportunity to at least simulate, using one of those. That could be dirty, could be nasty, it could be a source. Fortunately with us, we keep it clean and everything else, so, but that is a possibility. So what you want to do, you want to wear gloves, mask, and then just, normal safety and disinfection standards. Then we have vector-borne. Once again, it's not really, we may have patients that come from the outside that, have this mode of transmission is from insects or animals. So you think about mosquitoes around here, because we have a lot of rice paddies, and then Lyme disease from the ticks. We have a lot of, outdoor activities and, wooded areas and stuff like that. And then rabies. We have a lot of coyotes around here. So with the PPE, obviously, there's nothing on the inpatient side that you're going to wear to protect yourself. But there's protection barriers that you can do, insect sprays, mosquito nets and stuff like that. So that would be more like patient teaching to avoid the contact. So any question there? We good? Okay. And once again, you're not going to be tested on the specific, the information that I just gave you on the modes of transmission is just a review. Review on the reason that we have the policies and procedures that we do as far as PPE and removing linen and all that. Okay, so now what we're going to talk about is the different solutions that we have and the kill times that go with that. The first one is hydrogen peroxide, and this right here, the kill time is 1 minute. And it's really nice. You don't have to remember all the kill times because one, you have it, have you guys received your badges yet in this little blue thing? It has it right on the back. Actually, blood spills is on the other side too, which is really nice. So if you're wondering if it's 1 minute, 2 minutes, 10 minutes, just look at this or ask somebody. We also have it, for example, if you look right here, it says 30 seconds. But for Ride Out, we have these little stickers because it's a minute here. Okay, our policy is 1 minute for the hydrogen peroxide. So look at the little stickers, refer to your badge, or ask a peer. Ask somebody you work with, what the proper time is. Then we have bleach. Bleach is 1 minute, unless you're disinfecting like equipment or something that's coming out of a room, a C. diff room. They're in isolation because they're positive, or they're ruling out C. diff, okay, or active diarrhea. That's going to be 5 minutes. And of course with your hand, soap and water. Then we have the Sandy wipes. The Sandy wipes are 2 minutes, and you can look right there. It has it printed on there, but then usually we have a sticker also. And these are similar to the baby wipes, but don't use them on baby butts. And it actually has a picture for that, just in case. And all of these are, I mean, they're readily available. They're everywhere. In the patient's room, on the isolation cards, and so they're easy to find. If you run out, just ask monitor tech or one of your peers, and they'll let you know where to get it. Okay, then we have a couple of other items. It's called A4562. In the year that I've been here, I haven't seen this yet, but we use it to clean up blood. With blood, we're going to use the A4562, and then, or you can use bleach. But if you look at it, you can see a picture of it, and then here's the bleach, the spray bottle. So we have the bleach wipes, and then the 5% bleach spray, and this would be for blood spills. Okay. That is a 10-minute time kill. And then whenever we review how to clean up a blood spill properly, according to our policies, then we'll review that again, but definitely 10 minutes. Then we have ChlorPrep. ChlorPrep can come in a wipe, or it can come like in a little, you guys have probably all seen it, like the little stick, and you squeeze it, and then you, when you're doing central lines, or maybe doing an IV start or something, then you put it on there. That is a 3-minute kill time. And then Curo's cap. Does anybody know what those are? Little green caps you screw on the end of the needleless. Of course, most hospitals use the needleless port system now. But we have these green caps, and they go on the end of it. Once you put it on the end, it takes 3 minutes for that to be sterilized. It's a one-time use. So let's say you're going to use the port, get one of those green caps, put it on there, and then next time you come back, as long as it's been within 3 minutes, and most likely it will be, then it's going to be disinfected, so you don't have to use the alcohol. That's actually decreased. I don't have the exact numbers, but I mean the literature is out there. Using those caps has decreased the infection rates with our central lines.
84%.
84%. That's amazing. Yeah. So with the alcohol, you're supposed to use it for 12 seconds, but how many people use it for 12 seconds? Like I told you guys how long I've been a nurse, and I just found out when we started using the Curo's caps. Yeah. So they're absolutely fabulous. So any questions on the kill time? Remember, it's on your badge, and you've got your peers, and then usually there's a sticker on the front. One thing to remember I didn't cover before I keep going, when you have a large piece of equipment, you think about a gurney or a bed that you're cleaning, you need to divide that into 3s. Okay, so whatever you're using, let's say you're using the hydrogen peroxide, 1 minute, you're going to divide 3 top to bottom, do it for an entire minute, and then the middle portion, and then the last portion, okay? You don't want to like do the entire top, and because really what you're doing is like smearing the germs from place to place. And it's just more effective if you divide it into 3s for the large piece of equipment. And remember, you always go like top to bottom, dirty to clean, okay, for any piece of equipment that you're using. Any question on that? Okay, blood spills. So this right here is going to be your first return demonstration. And when we say blood spills, we're talking about large blood spills. So we're talking 60 cc's. So it's not really, you know, it's less than a half a cup. It's about a third, you know, of a cup of water. But for blood, obviously, you know, that's quite a bit. So what you want to do, first of all, if you can, it could be you're busy, it could be you just need additional assistance, but call environmental services. You can have a monitor tech. There's a monitor tech on every floor, and they've got the number, and just say, hey, I've got a blood spill, and call them. But obviously, you need to know what the policy is, okay? So what you're going to do is you have a spill, you're going to apply PPE, so you want a face shield, you want gown and gloves, okay? And that's going to be either in the room, it's in the isolation cards. You just ask somebody when you're on the floor, and they'll show you where it's at. Then what you're going to do is you're going to get some absorbent material, and what I recommend is the Chucks, because it's readily available, very easy to use. And what you're going to do is just put the absorbent side down. So we've got a blood spill right here, absorbent side down. You're going to soak it all up. You've got your PPE on. And then you're going to take this and you're going to put it in your red biohazard bag. In all the rooms they have, you know, the linen cart, they have the red biohazard bag, and then, you know, the hard red plastic thing that the bag goes in, and then you have your regular trash bag as well. So this is going to go in there, okay? So we've got that in there. Then what we're going to do, so we've disposed of it in the red biohazard bag. Then we're going to flood the area with the disinfectant. And remember, we're going to use one of these two. We're either going to use the bleach, the spray bleach, because it's 5%, or the A4562, okay? So we're going to flood the area, and we're going to wait. Does anybody remember how long?
10 minutes.
10 minutes, yep. And if you forget, it's on your blue badge right here. So we're going to wait for 10 minutes, and then we're going to get another clean chucks or some kind of absorbent material, and we're going to clean up that disinfectant, okay? And then that is going to go into our red bag. Then, so we're finished. We've cleaned up the spill, we've disinfected it, we've cleaned up the disinfectant. And so then what we're going to do is we're going to take this and we're going to gooseneck it. Have you guys learned goosenecking? Okay? So you're going to twist it. It's easier to twist when you have weight. Twist it up. So we're going to twist it and tie it. And that is called the gooseneck. So why would we not tie it like the bunny ears or whatever you want to call it?
Because it still leaves an exit room.
Exactly. Yep. So this right here is pretty much foolproof. Yep. Okay. So we have it goosenecked, and we still actually have, I wish we had one of the hard red plastic ones, but you guys have seen it, even in nursing school you've seen it. So we have this thing goosenecked, we have it set right there. And so then what we're going to do is this right here actually needs to go into the red bin that we have, the mobile bin in the dirty utility room. So what we're going to do, right now you'll just be tested as an individual, you know, one person instead of two person, but you can do this with two person as well. So you've got your gown and your glove on. Let's say this right here is the threshold of the door. This right here, we're going to put it near the threshold. Okay? So we're going to remove our gown, our mask, gown, gloves, and everything. We're going to put that in the trash. What are we going to do before we exit the room? Hand hygiene, obviously. Yeah. So if it's a C. diff room, you're in isolation, of course you're going to use soap and water right before you leave. If you're just using the alcohol, it's right outside the door, so you just reach out there, you'll do your hand hygiene, okay? And then you're going to go and you're going to get the red bio card, the mobile bin. Okay, so you're going to take that biohazard bin, you're going to take it to the threshold of the door. This right here, for testing purposes, this is not an isolation room, okay? So you don't have to glove back on, but you do have to do your hand hygiene again. You're going to reach in there, let's say this is inside. Reach in there, you're going to grab it, you're going to put it in the red bin, okay? So now it's in the mobile bin. We're going to do our hand hygiene again, and we're going to take this back to the dirty utility room. And then, so now this is in the dirty utility room where it belongs. Before we leave that room, what are we going to do?
Hand hygiene.
Yep, hand hygiene again. So any questions on that? So just remember, anytime removing gloves, you know, putting on gloves, removing gloves, if you're leaving a room, going into a room, or you're reaching into the room to grab that bag, you know, you're going to do the hand hygiene. Which is why we try to take care of our hands. We use so much alcohol swab. So any questions with that? And once again, you'll be tested just on one person. Okay. Any questions? All right, so we'll go on to the isolation rooms. And it really doesn't matter what kind of isolation, because for our purposes here, we're going to say contact, we're going to say, you know, the gown and the gloves. But you're going to, it's whatever's appropriate for that type of isolation, you know, the mask, whatever. But for here, we're just going to say, you know, it's the contact, so gowns and gloves. Keep it simple. Okay, so with one person, we're going to do one person first. We'll review it, and then we'll do two person. And you guys will be tested on all three, on the blood cleanup, one person and two person. So you're already in the room. So if you're already in the room, you already have your isolation, you know, your gown and your gloves on, okay? So you've already, let's say we're doing linen. So you just did your linen change and everything else. You've got your linen in the bag. The only thing I have is the red bags, but this is a linen bag for our purposes, okay? So you got all your linen in here. So what you're going to do is, you guys tell me. You're going to gooseneck it, definitely. And trust me, it's much easier to gooseneck when you've got some weight in there. So, kind of like that's been goosenecked right there. Okay. So we're going to gooseneck it. Now, you're an individual by yourself. We're going to use this one. It's already goosenecked. This is our linen. So once again, you're going to place it at the threshold of the door. You're going to remove all your gear. You're going to dispose of it. You're going to do your hand hygiene. Okay, well, just alcohol. It's not C. diff. Okay, for the testing purposes. So you're going to alcohol out, and then it's pretty much exactly the same that you did with your blood spill pickup. So you guys tell me. I just did my alcohol, and I'm leaving the room. What am I going to do? What's the next step? Go to the dirty utility room. Yep. And I'm going to get the mobile bin. Yep. It's either gray or blue. Blue is for linen, gray is for trash. Then we have a red one for biohazard. Okay, so when we're going to get that bin, and where are we going to take it? Are we going to take it into the room?
No.
We're going to take it to the threshold of the door. Right. So now this is an isolation room. So now we've got the bin there. So what's the very next step? Are we just going to reach right in?
No. Put gloves on.
We're going to put a glove on. And before we put the gloves on, what are we going to do?
Hand hygiene.
Because we always do that before we put our gloves on. Okay, so you guys already know this. So we're doing our hand hygiene. We're going to don our gloves. And then we're going to reach in there, and we're going to remove that bag from the isolation room. We're going to lift the lid up, and we're going to drop it in our mobile bin. Okay? And then we're going to... So now you've got this glove that you just touched an isolation bag with. So what are you going to do with it?
You want to take it off and put it in.
You want to take it off, yeah. Hopefully you'll be able to, our bins, we have 2 bins together. We can take that lid and set it on the other one, and then we can take our gloves off and put it back, and then you can do your hand hygiene. So it makes it really easy. Okay, so now, and what are we going to do?
Take it back
With
to
our
dirty
bin.
utility.
And before we leave the
Hand
dirty
hygiene.
utility, yep, we're going to alcohol. Yep. All right, any questions on that? That was one person. Okay. 2-person, it's pretty much the same thing. It's just that you're splitting the responsibilities. So you have one person, they're already inside the isolation room. Okay, so they already have their gown, whatever the appropriate PPE is. For us, it's going to be gown and gloves, contact. So they're going to gooseneck the bag, and then they're going to stand near the door. Obviously, they're not going to step over the threshold because they're in an isolation room. So they're sitting there waiting for the second person to come. So the second person, they're going to go get the mobile trash can, and then they're going to go to the room, and they're going to remove the lid. Okay? When they remove the lid, because you're standing right there at the threshold, the person then can drop the bag into the trash can. Okay? And then they can put the lid back on. Okay? And then that person can take the bin back to the dirty utility, and of course they're going to do their hand hygiene. Okay? Now the person in the room, what are they going to do? They're fixing
Take
to
off
do
their PPE and hand hygiene.
and hand hygiene. All right. You guys got it? Any questions? 5 more minutes? Okay. Thank you. All right. So that's it. What we're going to do is, if you guys don't have any questions, go ahead and test you. And I think as far as the videotaping, just for my class presentation, maybe we'll just get a couple people. It has to be at least 30 minutes, but I won't put my instructors through testing everybody. Maybe I'll get extra points for that. So with that, you want to start, we'll just get 2 people. Do you guys mind going? Come on, let's do it. And we'll do, you do the blood spill. I mean, the blood spill. And then do you want to do each one of them? One of them can do the 1-person isolation. And then we'll have you guys come together. So I'll test you on blood spill, and then Brenda, if you don't mind, you can test her on the 1-person isolation. And then we'll have you come together and do the 2-person, and you just swap roles. Does that sound like a game plan? Okay. So with that, we've got gloves here. Do you guys need a review on how to take off gloves properly?
No.
You know what, let me give you a quick review anyway, because sometimes we think we don't need a review, but you'll see some crazy stuff.
That'll be your 5 minutes.
So, there you go. Try not to rip it. Okay, Okay, just remember these are dirty. So you want to take this like this. Okay, now this you can take on the inside. These rip easily. I like our blue ones better. But you don't want to just take your dirty gloves and take it off like that, okay? And you'll find that you can't really pull them off. So just remember that. Be cognizant of what's dirty and what surfaces that you're touching. Okay. So, and what was your name again?
Audrey.
Audrey. So if you'd like, you can come over here and we'll do the blood spill. And what we'll do, we don't have the spray, so you're going to do this and you'll tell me 10 minutes. A lot of the stuff you're going to talk through. Okay. And you're not in an isolation room.
Okay.
Go ahead and have it put the
But you
gown
do
on. You do have to put the gown and gloves for protection. And normally you would also you would want to protect your eyes because you're cleaning up blood.
Okay.
So we don't have that, but yeah, just be aware of that. Okay, and then we can use this right here. And then if you'd like to come grab your stuff for your one person.
Can I start doing this?
No.
No.
Let me get her settled real quick and that way I can watch you.
Okay.
Is large gloves okay?
Medium's better, but I'll take large.
Okay, there's some medium right there. And then you can take this bag.
Thank you.
There you go.